Good afternoon. On behalf of the NC Chamber, welcome to COVID-19 Reopening Best Practices for Businesses. I am Janelle Boyd with the NC Chamber. All attendees are muted to avoid any distractions during today's presentation. If time permits, we will answer as many questions as possible at the end of the presentation. If you would like to submit a question during the meeting, please use the question and answer box. Please do not use the chat box. You may upvote the questions you most want answered by clicking on the thumbs up for that question. The questions with the most votes will be answered first. The recording of today's webinar will be made available to you via email within 24 hours of the webinar. Now, I would like to introduce Veronica Bryant, the Emergency Preparedness and Outbreak Coordinator for the North Carolina Department of Health and Human Services. Veronica has served as one of the Environmental Health Section's leads during the COVID-19 pandemic response and is here today to discuss proper disinfecting procedures, social distancing recommendations, hand hygiene, and other best practices as we move to reopen. Veronica?
Thank you. Good afternoon, everyone. I know that this has been an interesting time to be working and in business, and so happy to be with you today to speak with you a little bit about what the state says will be the best practices and guidance moving forward. Can I have my slides up, please? All right, thank you. So you can go to the next slide. I think that most people have been kind of ingrained with this idea of, what COVID-19 is. COVID-19 is really a shortened version of coronavirus disease, and it is caused by the SARS-CoV-2 virus. And CDC continues to expand what they know about what are common symptoms, that as of right now, the most common symptoms are fever, cough, shortness of breath, and then chills, shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. Next slide. One thing that we have all kind of realized in this is what we really are going to have to do is ask for a new way of people in our state and in our country to live and work and play in order to get through these next weeks and months without having to continue on full stay-at-home orders. So the most recent campaign from the state Department of Public Health, and what you will be hearing about, I think, as we move forward into phase 2 and some additional reopenings, will be this: remember your 3 W's. And these signs and messages are good things for you to share and to be mindful of in your business and in your personal life as well. So the first W is wear, for wearing a cloth face covering when you are out. Wait, so keep your distance and avoid being more than 6 feet from someone, or less than 6 feet from someone, and then making sure you wash your hands often or use hand sanitizer. So, next slide. Just to give you kind of like an overview of what I'm going to cover in the next few minutes, these are really, as we're looking to provide information to businesses of all types, whether it's a restaurant or a retail business, a gym, you know, a childcare center. These are really some of the main principles that we're looking at in order to reopen and keep the risk lowered. So I'm going to go through each of these kind of in a more specific way and talk about things that you can do in your business to help support these principles. So increasing social distancing, implementing hygiene protocols, monitoring workforce symptoms, protecting vulnerable populations, and providing education. Next slide. Social distancing is something that, you know, if you would have told me back in February, that would be a term that everyone, you know, knew and understood. I don't know that I would have believed you, but as we moved into this kind of new normal world, you know, we all know kind of this term about social distancing, keeping 6 feet apart from one another whenever possible. And if you have to come within 6 feet of someone, you want it to be for a very brief period of time, so less than 10 minutes. 3 main ways that you can increase your social distancing have to do with modifying the physical space or the structure, so giving cues and blocking off areas so that your space is more conducive to social distancing, limiting density of people in an area, and then minimizing opportunities for people to have that sustained exposure of being closer than 6 feet with people for a period of time. Next slide. So here are some ways that you can think about increasing social distancing in your own business. I tried to keep this very broad so that it does apply to a wide range of businesses. As we move forward into thinking about what phase 2 will look like, the state will provide some more specific guidance and instruction to business types. So if you own a specific type of business, you may get some more detailed information, but in terms of increasing social distancing, you can see in this picture, and you've probably seen it as you've been out doing your grocery shopping or whatever, a physical barrier here between the customer and the cashier to protect both of them from each other. Signage reminding customers to keep distance along with floor markings. So if you have an area where, whether it's a dressing room or an area leading up to the cash register where people normally are, you know, marking the floor so to remind people where 6 feet is so that they keep their space. Right now, the phase 1 limit on density of people is at 50% capacity. We don't know exactly what phase 2 will look like, but just, you know, keep in mind that there will likely be some restriction as to how many people can be in your business at once, which will require some additional staff maybe to keep count of who's in the store, or click people in and out and that kind of stuff. Touchless payment methods are a really big one where if less people are touching the credit card machine, it is a, you know, that's one less touch point that you have to be worried about from a cleaning and disinfecting perspective. We want people to be kind of sensitive to the fact that people will have varying levels of being ready to go out when it's time to ease restrictions. So continuing to offer some online or phone ordering with a curbside pickup for people will probably help keep some of those customers feeling comfortable in using your business, if that's something that you can do. And then, you know, making sure that everyone is wearing cloth face coverings. Early on, you know, that was not the recommendation, but since about the beginning of April, CDC and the state recommend that everyone wear a cloth face covering unless you are a child under 2 or you have some medical reason why it's not possible for you to wear a mask or a face covering. We're trying to get away from the term mask. So next slide, please. The next big thing that needs to happen in order for businesses to reopen safely would be to disinfect the surfaces and common spaces in your establishment or business, and having good hygiene around for both your employees and your customers. So next slide. There is a list of disinfectants that the EPA has put out that can claim effectiveness against the COVID-19 illness or virus that causes COVID-19. And this list is very long and it changes pretty regularly, but I provided the link for you here to go to EPA to look at that. One thing that you want to pay attention to when you're selecting a disinfectant is the column that says the contact time. So it takes a certain amount of time for viruses to be inactivated by a disinfectant, and that is going to vary. A strong bleach solution, which is like 1/3 of a cup of bleach in a gallon of water, can do that within about a minute. Some of the other products that are marketed out there can take up to 10 minutes, and that means that the surface has to remain wet with the chemical for 10 minutes to get that level of kill. And so you really want to pay attention, because if you're a business that has rapid turnover and you need to be able to disinfect things and get somebody else in there pretty quickly, you want to choose something with a shorter contact time. If you have a little more time between customers or guests, you may not be as concerned, but you need that contact time to be completed before the surface would be considered disinfected for the next use. We also would like to see available and convenient hand sanitizer, both for your guests or customers as well as your employees. We know that right now it can be difficult to get your hands on this product, but we've seen some really innovative things that North Carolina businesses have done to try to help with this. A lot of the distilleries have started making this in large quantities and selling to the public and other businesses. So, I recommend just trying to find hand sanitizer when you can and when it's not available. And even when it is available, you want to promote hand washing as best you can. So make sure you keep your soap and paper towel dispensers, fully stocked. Even more important now than it was before, to have somebody checking those periodically throughout the day. And then all of your high touch items, which can be a range of things. We know that doorknobs and shopping carts and things like that are high touch, and that makes sense to us. Bathroom handles and sink faucets and things like that. But depending on your business, you may have different high touch surfaces. If you're a fitness center, your treadmills and your medicine balls are going to be high touch center or high touch surfaces. If you are a art studio, your paintbrushes and those kinds of things are going to be high touch surfaces. So just go through your business and look at what people are touching and make sure that those are the areas where you're focusing your disinfection. And then hand washing, again, is important when you start work, after you touch your face, and anytime you change a task. Next slide, please. So this picture kind of shows where we're at in terms of this world that we live in with people, constantly having to be screened for their temperature. But there are other ways to do this, and we don't necessarily think that every business needs to have a thermometer where they're checking every person's temperature, but we do think that it's very important for employees to be checking their own temperatures if you're not checking it at work, and providing you with that, providing that information as applicable to the employer, or being able to sign off that they meet the criteria to be at work so they don't have a fever. But enforcing sick policy is really important right now. Implementing the screening, and then providing some resiliency and support resources. So we'll go into the symptoms a little more on this next slide, please. Okay, so like I said, with temperature checks, this one can be tricky. I know that some businesses are doing it on site. Other ones are more hesitant to do that, either from a comfort level, or they can't get a thermometer that they feel like is, keeps the person taking the temperature safe enough from the employee. So, either have the employee take it at home and be able to report to you that they are fever-free, or some sort of screening at work. And it's going to really depend on, how much interaction your employees have with the customers as to how high that risk is. But you want to make sure that you're enforcing sick policy, and that people who are sick at the start of the shift don't start working, and if they become sick during the shift, that they leave immediately. Once someone has been excluded because they are sick, these are the criteria for return. So no fever for at least 72 hours, and that's without taking Tylenol or Advil or something to suppress a fever. Your other symptoms, such as coughing and shortness of breath, need to have improved, not necessarily gone away, but you need to have improved symptoms, and it needs to have been at least 10 days since you first had symptoms. So you can see that once somebody's been diagnosed or presumed positive with COVID-19, it will be a while before they can return to work. And so as an employer, it's really important to do what you can to keep your workers healthy, because if they all go out of work, it would be 10 days before they could return. Another thing that we think is helpful is to think about putting your employees in cohorts, meaning that the same employees work shifts together. And what that will do is, if you do have a big exposure by a sick worker, it doesn't take out your entire workforce, because I may have worked with 1/3 of my coworkers on Monday, and a different third on Tuesday, and the final third on Wednesday, and then on Thursday, when I find out that I'm COVID-19 positive, I have now potentially infected the entire office. So if I only stay in contact with that first three, or that first third, that means that I still have 2/3 of my workforce available to continue to work. And then, everyone's mental health right now, I think, is struggling in different capacities. And so, providing some of those resources, or at least being, patient and sympathetic with folks as they return with their anxieties. Everybody's in a different risk state. And so it's important to keep those things in mind. Next slide, please. And this is just a copy of the daily symptom screening that's been posted for childcare centers, and we assume that the questions will be similar for workers as they return to work. So have you or any of the children you are dropping off had any of the symptoms of the coronavirus, been in contact with anyone who has had those symptoms, which again is fever, cough, shortness of breath or difficulty breathing, chills, new loss of taste or smell, and then in children, vomiting or diarrhea since the last time you were here, or the last time you worked. And then the third question is, have you potentially been exposed to COVID-19, or have reason to believe that you have been exposed to COVID-19? So those are the types of questions that we want you all to be thinking about, how you would implement that into the start of work every day as in every shift. Next slide, please. We know and have seen some devastating effects of this virus among all people, but particularly with the vulnerable populations. So depending on what your workforce looks like, you may have more or less of these people who are high risk, but not all of the categories of high risk are easily identifiable to someone who is not the employee. So you want to allow your employees to self-identify as high risk. They may have diabetes, they may be caring for a parent or a spouse that has cancer, or they may have an autoimmune disease that makes them more likely to suffer from severe illness. And so you want employees to be able to self-identify and then try to find tasks for them that require even less interaction with people. And you know, if you're a business, again, depending on what kind of business it is, you may want to consider having a special period of time or a certain day where you have folks who identify as high risk come into shop just with other folks who identify as high risk, just to help with their comfort level and get them back out and, you know, into our economy and stuff. And again, you know, remember that not everyone is going to be ready to rush out and do a lot of these things outside of their home. So the more you can continue some of the innovative things that are being done in terms of delivery and online or phone payments and, you know, curbside pickup and those kinds of things, will continue to support our vulnerable populations as they try to keep themselves healthy as we begin to reopen. So next slide. And then, you know, there is a lot of information, whatever type of social media that you may consume, or even news, you know, a lot of it is not meant to be from a place of malice, but there's just so much that we don't know about the virus, and people are trying to make inferences or, you know, make assumptions about what it does or what it means, what the data means. And so I really, really encourage you all to make sure you're using good sources of information for yourselves and your customers. The 211 and the text alerts, the COVID-19 text alerts are both great things. So you can try to promote those to your staff and to your customers. And then, you know, in this last minute or so, I just want to make you aware, and there'll be more information available hopefully tomorrow, but WRAL kind of broke the story today that we at NCDHHS have partnered with the Restaurant and Lodging Association as well as NC State University and Visit NC to come up with a campaign that is both for employers as well as the employees and the public that they serve, where there will be free, no cost to anyone training programs that are offered to management and to front level staff of restaurants, as well as some additional training programs that are geared towards all businesses that will allow you to complete the training course and then be enrolled in this program called Count on Me NC. And what will go along with that is a lot of information about what customers should be doing and what the businesses are doing to try to keep people safe. And it's a program that we're really excited about to be able to offer. The rollout of that, like I said, may be tomorrow. So look for a press release and information around that Count on Me NC program. But that is something that once the, if you're a restaurant, the restaurant courses will be available starting tomorrow. If you're another business, those programs will be available in the next few weeks for you all to take advantage of, and we're hoping that that logo and that count on me and see is something that people see, and it helps restore consumer confidence that all of us are doing what we can to try to keep each other safe. So I believe that is my last slide.
Thank you, Veronica.
Yes.
Now, I would like to introduce Michael McKnight of Ogletree Deacons. Michael provides counsel to and represents employers in all types of labor and employment matters and will cover liability traps to avoid as businesses relaunch in the new environment, including employee health and safety issues, lead laws, retaliation concerns, and best practices to minimize risks in these areas. Michael?
Thank you very much, Janelle. And one of the main things I've been doing lately is helping employers develop return to work plans that comply with the available guidance that's out there, and also helping employers respond to employee complaints that have been lodged with OSHA and other state and federal agencies that are related to the virus and the steps that are being taken to protect employees from the virus. On the first slide, I've got it details one of the main traps, so to speak, that employers have to deal with when confronting this virus. And in fact, all these slides, I've got 10 different potential liability traps, as Janelle mentioned in her introduction, that I want to go over today. These are not necessarily in priority or specific order. They are grouped together by topic, but I hope these may be at least among the top 10 liability traps that you want to consider as an employer. So trap number one is ignoring OSHA and CDC guidance. And of course, those of you who are familiar with OSHA know that there's no specific OSHA standard or regulation that requires employers to do anything regarding COVID-19. OSHA does have a general duty clause here in North Carolina, as it does in all other states, that requires employers to furnish a place of employment that's free from hazards that are likely to cause death or serious physical harm. And so when OSHA goes to enforce things related to COVID-19, they're going to be looking to the general duty clause as their authority to do that. But federal OSHA has also told us that guidance and guidelines that are provided by the CDC and other agencies, and that would include the agency Ms. Bryant works for, Department of Health and Human Services, that following those guidelines is essential, and that those guidelines put employers on notice of hazards and potential feasible means of abating those hazards. So those are things that you'll want to think about as you reopen and move forward. And also, OSHA has not published a whole lot that's very industry specific lately, but they started rolling out some very industry specific guidance today. And just before we got on this webinar, they rolled out guidance for pharmacies, for long-term care facilities, and for taxis and other ride-sharing services. And I think the plan is for them to continue to roll out industry-specific guidance. So last week they rolled out some industry-specific guidance for the meat and poultry industry that's very helpful, not only for that industry, but also for manufacturers in general who may have issues with maintaining social distancing in the workplace. That guidance provides some alternatives when you're not able to do that. The next slide follows up on this one and provides some best practices. And the overall guidance is to evaluate your workplace and make feasible changes. So, and OSHA has said that employers who make good faith attempts to follow OSHA and CDC guidelines will benefit from what they call enforcement discretion. In other words, OSHA is not looking to cite employers who attempt to follow these the guidelines that Ms. Bryant spoke about and that other government agencies have put out there. And that's also been my experience, particularly here in North Carolina, when helping employers respond to complaint letters received from OSHA. As long as employers outline what they've done, if they're not able to do certain things, if they explain why, OSHA's typically dismiss those pretty quickly if there was an adequate explanation for that. So My advice in this area is to consider what changes you can make to reduce the spread of the virus, adopt a written plan to implement those changes, and then let your employees know what that plan is, train them on that, in other words. Also consider engineering work practice and administrative controls as an alternative to providing what you might consider PPE in terms of controlling the virus. And what I mean by that is reconfigurations and scheduling changes to allow for greater social distancing, use of plexiglass and other physical barriers. That's one thing I've seen clients do really well in the manufacturing environment. A lot of times it's simply impossible for employers to maintain or employees to maintain 6 feet of distance from each other in those environments. So physical barriers like plexiglass are a good alternative. Cohorting that Ms. Bryant spoke about is another very successful thing that I've seen put in place. And that way, if someone in the group happens to get the virus, you don't have to shut down the entire workplace. You put those people out of work, make sure no one else develops any symptoms. You do a deep clean of the workplace, and then everyone else can keep going. And the other thing to think about is if you got the air circulation in your building, you got to think about air conditioning, adjusting fans and all that. As we head into summertime, that's going to be particularly important as well, to make sure people don't get overheated on the one hand, but that we don't have those things arranged in a way that they spread the virus. The second liability trap I wanted to talk about involves inadequate PPE and supplies. This is one of the most common OSHA-related complaints that we've seen so far. So if you decide PPE is needed to protect your employees, make sure that, number one, you're providing it and paying for it, and also make sure employees are using it properly. And other items such as face coverings that Ms. Bryant spoke about, they are not considered by PPE by OSHA, and they're not regulated. But they may need to be treated similarly in that you may, if you're going to mandate face masks and face coverings, then you'll want to provide those. And if you decide to provide N95 masks, which are considered face filtering or filtering face piece respirators, there are specific OSHA requirements that come with those, and that includes you either have to adopt a respiratory protection program and provide training to employees, including fit testing and a medical exam, or if you allow employees to wear those respirators voluntarily, you're going to have to provide them with Appendix D. It's my understanding that the guidance from government agencies is to leave those type masks for the healthcare workers and instead focus on cloth face coverings, as Ms. Bryant mentioned. Also, having a solid return to work plan, I think it's important to remember it does no good if you are mentioning supplies, but you don't have them available. And that's what the next slide gets at that and mentions the importance of having adequate supplies of PPE where that's deemed necessary, but also non-PPE supplies that would prevent the spread of the virus. And I've listed some examples of those there. That's another common area that will invite employee complaints unnecessarily, is if you have everybody come back, but you don't have these items available. I think having the disinfectant available, adequate soap and water stations, or at least hand sanitizer, all of those things are very important. Now, one area that we're seeing also increased incidence of is chemical burns, issues with chemicals. If you are going to have chemicals used in your workplace, even if they're common household cleaning chemicals, you've got to comply with the OSHA hazard communication standard if those chemicals are used in a greater capacity than they would normally be used by employees in their home, and that's often going to be the case. So if you have that, you want to make sure that you have your safety data sheets available, that you have the chemicals properly labeled, and that you have a hazard communication program and that employees are trained on those. I do think that is a potential sub-liability trap in all this that may pop up. Trap number 3 deals with a lack of appropriate screening mechanisms. And I know Ms. Bryant spoke about this in her presentation. You want to conduct screening in your workplace that matches the level of risk that you have. OSHA has a hierarchy of risk or a pyramid of risk, and most folks are at the lower levels or lower or medium levels of that. Only healthcare workers, sanitation workers, and so on tend to be at the top. But you're going to want to conduct some level of screening, even if it's just having a sign on the door, as has been recommended for daycare centers, saying that if you enter, you acknowledge that you do not have symptoms of the virus, you've not been exposed to anybody with the virus, and so on. So you want to follow both the CDC guidelines and EEOC guidelines when you're conducting employee screening. And so EEOC says, and that's the Equal Employment Opportunity Commission for those of you not familiar, but that's the agency, federal agency that enforces employment discrimination laws. They want to make sure that you're treating employees in the same type of job the same if you're doing screening. So don't pick and choose amongst employees. You want to maintain the confidentiality of any medical information you obtain. If you get specific medical information about an employee who has the virus, that needs to go in their medical file, not their personnel file. All medical information for employees needs to be separate from a personnel file. And you also want to ensure that any inquiries you make about the virus are job related and consistent with business necessity. That is the legal standard for asking employees about health information. And in terms of CDC guidance on screening protocols, the CDC has a web page dedicated to specific screening protocols. Our law firm website has a blog that details these screening protocols, but they're basically three approaches. A social distancing approach is probably the approach that's going to be used by most employers, where employees take their temperature on their own and the employer asks them questions from a distance through a representative about their exposure to the virus. In other cases where healthcare settings and probably food processing settings and things of that nature, you would use a barrier and partition approach where someone might actually take the temperature of employees and stand behind a barrier or partition. In other cases, they might use, the screener might use PPE to protect himself or herself. And the CDC has outlined guidance for doing that and guidance for proper use of a thermometer to take temperature and so on. I won't go into those specifics today, but the point of this one is make sure that you have adequate screening mechanisms in place that match your level of risk. Trap number 4 involves not addressing employee complaints. And I think a lack of communication can be really bad news for employers in this area. So far, OSHA has received 3,000 plus COVID-19 related complaints. And this is just the states that are in federal OSHA. It doesn't include states like North Carolina who have their own state plans. That's another 20 some states there. And there were also 300 plus whistleblower complaints received. That's people alleging retaliation for reporting workplace issues. In North Carolina, we have a law that's called RETA, the Retaliatory Employment Discrimination Act, that prohibits employers from discriminating or taking any retaliatory action against an employee who files a claim or complaint or initiates an inquiry, investigation, inspection, proceeding, or other action related to a workplace safety issue, or anyone who threatens that they will do so. So that's a good rule to remember there, and that law applies to employers of all sizes. So a lot of times laws don't apply to smaller employers, but the RETA law applies to employers of all sizes. So you want to be mindful of that fact when people raise a concern with you that could be protected activity, and you want to be careful about taking any adverse action or any action that may be deemed to be adverse against that particular person. Also, educating your employees about your return to work plans and your plans for handling operations for the remainder of the pandemic is one of the best ways that we've seen that can curtail employee complaints. And if there are employee complaints that have been received, that's a good time to have a communication either in the form of a memo, a meeting that involves social distancing, a telephone call, something to let people know that concerns are being heard, they're being addressed, and that they are welcome. That is the best way to avoid liability out of those. Trap number 5 involves wage and hour compliance. And of course, there's a lot of employers now who are cutting back on pay and hours worked. And also, there's a lot of folks working from home and so on when they would normally work in the office. So if you happen to have employees who are considered exempt, they get paid a salary, doesn't matter how many hours they work. You have a wide range of latitude in what you can do with those folks, but you've got to pay them at least $684 per week and make sure they maintain their exempt job duties if they are going to continue to be a salaried exempt employee. And a good example of someone who might lose their exempt status is someone who meets the executive exemption because they supervise 2 or more employees, and you lay off those employees. If they're no longer supervising 2 or more employees, then they're not exempt and they need to be paid hourly. And for a lot of people who are considering cutting hours for exempt employees, they they decide to convert those employees to being paid hourly, at least temporarily, so that they can pay for reduced hours and all that. If you're familiar with the wage and hour law, you know that exempt employees, if they work one day in a work week, they must be paid a salary for the entire week. So it's not a situation where you can tell an exempt employee to only come in a couple of days and then you'll cut their salary accordingly. You can cut a salary, but the reality is you can't cut hours for exempt employees normally. So that's something to keep in mind. And secondly, you want to ensure that your hourly employees are paid for all time that they work. There's a lot of hourly employees now who are working from home who otherwise would have never worked from home. And you got to make sure they're recording all their time. The other area that we see the potential for class action type lawsuits in is people who are spending time waiting to be screened for employment. And there's all kinds of law out there about donning and doffing equipment and so on. But the best practice at this point is to pay people for time spent while they're waiting to be screened to go in the workplace. And then you don't have to avoid having a potential lawsuit out of that. Liability trap number 6 is forgetting about the new leave laws. The Families First Coronavirus Relief Act is effective through the end of the year. I think there's a tendency to think that that law might go away after we all kind of come back to work. That is not the case. So just briefly, that law provides a tax credit to employers who it applies to. It applies to employers with fewer than 500 employees. If you have more than 500 employees, that law does not apply to you. But the people in each of the 5 categories listed here, they will get 2 weeks of paid sick leave to care for either care for someone who's got COVID-19 or because they have it themselves, or they're staying out of work because they have it themselves, or they've got to care for a child who has it. Now, the last 2 categories of folks there that are in italics, those folks will receive up to $200 per day for the time that they're out for a total of 2 weeks. And the people in categories 1 through 3 will get up to $511 per day for 2 weeks if they're out of work. And folks in the last category can get a total of 12 weeks of paid leave if their child's school or place of care has been closed due to the virus. And all of that, of course, is reimbursable with tax credits that are reimbursed quarterly to the employer. Trap number 7 involves not considering your Americans with Disabilities Act obligations. The Americans with Disabilities Act, of course, requires you to make reasonable accommodations for employees who have a health condition that arises to the level of a disability. There's a wide range of things that are considered disabilities now under the Americans with Disabilities Act. So many, if not most, of the major health conditions people have are going to qualify. So if you run into somebody who's got a health condition or disability that puts them in danger of contracting COVID-19, or makes it so, for example, they couldn't wear a face covering if you decide to mandate that in your workplace or so on, you're going to want to go through the reasonable accommodation process with them. You're going to have an interactive conversation about what can be done to allow them to either remain in their current job, move to a new job if there's an available open job they're qualified to perform, or you'll need to discuss whether a leave of absence, and this is not a paid leave of absence unless they qualify for one of the forms of paid leave, or they are entitled to paid leave under your policies. But sometimes a leave of absence can be a reasonable accommodation. And again, when you think about what kind of accommodations are reasonable, it does not have to be the employee's preferred accommodation. It just simply needs to be an accommodation that allows the employee to perform the essential functions of his or her job. And so you're going to want to document your interactive process and the decisions you've made related to that. And I think this ADA area will be one of the biggest areas in which we see litigation arising out of this crisis. So I think this is one to pay particular attention to. Trap number 8 involves ignoring premises liability issues. I'll just cover this very briefly because one of the biggest misconceptions I think that's out there is that workers' compensation is going to cover employees who contract the coronavirus and have issues arising from that out of the workplace. I'm not clear either way. I'm not a workers' compensation lawyer, you'd want to ask your workers' compensation lawyer specifically about coverage there. But what I do know is that in cases where employees are exposed to conditions in the workplace, for example, mold, in the past, there's case law in North Carolina that says that if employees are exposed to those conditions in the workplace, they can sue the entity that owns the real estate. They're essentially under a premises liability theory, and those claims are not barred by workers' compensation. A lot of people think workers' compensation prevents employees from suing them at all for anything arising out of the employment relationship or any conditions they might be exposed to, and that's simply not true. So you want to be careful, particularly if you are an employer who has a different entity, a parent, subsidiary, or affiliate entity who owns the building where your employees work. And of course, premises liability issues for exposing people to the virus are always a concern for customers, third parties, and non-employees. So you just want to be able to demonstrate, I think, that you've complied with available public health guidance, the guidance that's going to be issued by the Department of Health and Human Services here in North Carolina, OSHA, the CDC, and any other state or federal agencies that may apply to your workplace. That will provide the best defense to those types of lawsuits to show that you exercised an appropriate duty of care in dealing with those things. Trap number 9 involves not following rules related to reductions in force or recalls of employees. I think this will be another area of big liability for employers, and you want to be able to show that you used objective criteria when laying people off and in calling them back. And you also want to make sure that you've complied with the WARN Act, which requires you to provide 60 days notice normally to employees if there's a mass layoff or a plant closing, and that's defined as a layoff that affects 50 or more employees at a single site of employment. There's some other criteria there that triggers WARN, but this is an area that we're seeing class actions already being filed in, and so that leads me into trap number 9. Trap number 10 is assuming this reduction in force is temporary. There's a lot of employers who did what they call a furlough or a temporary layoff, and they had assumed that it would last only a month or two, and it's going to turn out to last longer. If your RIF or layoff lasts longer than 6 months, that will trigger WARN if the 50 or more employee criteria mentioned on the previous slide is met. So you want to think about 2 specific areas to avoid class actions when you're doing layoffs or potentially separating employees. WARN is one of them, and it's not going to be good. There's a way out of providing the 60-day WARN notice if you can show there was an unforeseeable business circumstance that caused you to have to lay people off and not provide the notice. Right now, it's doubtful that just simply laying people off because of the virus, that's not going to be sufficient. You're going to have to show that there was another unforeseeable business circumstance that prevented you from giving that 60 days notice under WARN. And my advice to people has been, if you are going to lay people off even temporarily, provide the WARN notice rather than wait. If you've got a good reason now for why you're having to do it and you're not providing people at least 60 days notice, go ahead and provide that WARN notice, and you can always say that the layoff is not going to be temporary or not going to be permanent later if it turns out that's going to be the case. COBRA is also the other area where we're seeing class actions arise and being filed already. If people are going to lose their health insurance benefits, you need to make sure that you send them a COBRA notice. That doesn't apply, of course, if you're continuing them on your health care plan while they're on temporary layoff. And also under COBRA, there's specific elements a COBRA notice must have. The Department of Labor publishes a model notice, but if the elements of that notice are not in there or they're different, you can subject yourself to a class action. So that's in a nutshell that among the top 10 liability traps that I see arising. And I think we're going to move into questions now. I guess before we do, we've published a very extensive collection of resources on coronavirus for employers. This is the web link to that. I think there's a whole list of frequently asked questions and answers in more detail on the topics that I talked about today. So you're welcome to join that. All of those resources on there are free, and a lot of people have found them helpful.
Thank you, Michael. Now we would like to answer a few of the audience's questions. First question is, how should businesses handle cash?
I'll throw that one to Ms. Bryant.
Yeah, so there's a lot of misunderstanding, I think, about, the most risky things that people do. And for whatever reason, cash has been kind of in that category for a long time. What we know is that there can be a risk of handling anything, whether it's money or a doorknob or a menu, and then touching your eyes, nose, or mouth. The virus doesn't go through your skin, so it's not just the handling of money that's the issue, it's the handling of money and then touching your face with unwashed hands. So, minimizing that that hand-to-hand contact in exchange of money is a good idea. But as long as you wash your hands after you handle the cash, or an employee handles the cash, or you use hand sanitizer, there's really, the cash is no different than a credit card or anything else.
Thank you. Next question. Can we mandate testing of employees coming into work, and what if they refuse?
So the EEOC has put out a list of frequently asked questions, and answers, and that is one of them. And so the answer to that is yes, you can mandate that employees take a COVID-19 test to return to work. And my impression from reading that guidance is that you can administer that test, even though it would be considered a health exam under the Americans with Disabilities Act. You can administer that test and require employees to complete it, but the test must be reliable. It must be one that's approved by the Food and Drug Administration and be accurate and reliable. And I think if you're going to exclude employees from the workplace based upon test results, you certainly want to make sure that's the case. So you want to be careful and think about where you're getting those tests from and make sure they're accurate and reliable. But I think the answer to that's yes. If someone refuses to take the test, I think you have the right to place them on leave, an unpaid leave, or you have the right to consider whether discharge is appropriate or not, so long as you've talked through the issues through why the employee doesn't want to take the test, and it's not a reason that would require you to provide them with some kind of reasonable accommodation.
Thank you, Michael. Next question is, and what if we create a return to work policy that includes wearing face coverings and an employee refuses?
I'll take a shot at that one. Ms. Bryant's welcome to chime in if she's got some other thoughts. But I think the way to look at face coverings is just like you would that they're part of an employee uniform. And if you mandate that employees wear a specific uniform and they refuse to do it, you can normally discharge them for that refusal. But you also want to consider, are there reasons under the Americans with Disabilities Act that would require you to give them a reasonable accommodation? Is it that they can't wear the covering because of a medical reason? If that's the case, you want to engage in an interactive process. There also may be certain religious reasons that you have to grant religious accommodations for too, and I think you want to engage same sort of interactive process there. If it turns out that the employee raises one of those objections, I do think you want to find out why they don't want to wear the covering and what the reason is, and try to work that out as best you can. And the other thought, I don't know if this is coming or not for certain industries. It would not surprise me, for example, the beauty industry, when that comes back, if the state does not mandate those types of face coverings or something like that. I don't know if that's coming down the pipe or not.
Thank you, Michael. Veronica, did you have anything to add?
No, just that, I mean, for most people, this is still a strong recommendation, and people want us to talk about the requirement to do that. But, I think as an employer, you have more power to require that than, if we make the recommendation as an employer, requiring that is something that you're able to do. And there are people that have, depending on business and how long a shift is and stuff like that, there are people who struggle to wear the mask for an entire shift, and for health reasons. And it may be that you need to start thinking about ways that employees can have additional outdoor breaks, or breaks where they are distant, where they can remove the mask and, you know, have a little bit of time so you don't have people falling out on the floor.
Thank you for that. Next question. An employee has a condition that is listed by the CDC as making them at risk. They have a note from their doctor that they should be allowed to continue to work from home. However, the employee has an individual office. We have hygiene standards in place and requiring face coverings for all employees. You do not feel that this is a reasonable accommodation. Thoughts?
Well, you have a right to send the doctor a questionnaire under the Americans with Disabilities Act and ask the question why they could not, is there a reason why the employee could not return to work under those conditions? Would returning to work present a direct threat to themselves or others under the conditions you've described? And you have a right to ask that question. And if the doctor comes back and says it would not be a danger to the employee to do that, or you'd also probably ask in that questionnaire, are there other accommodations that we should be making that would allow this employee to return to work? It's important they be in the workplace. If there are no other accommodations and the employee simply refuses to return to work, I believe that you'd have the right to terminate at that point if there are not good reasons for the continued refusal to do that.
Thank you. Next question. Can you speak to any training for schools and universities?
So right now, with schools being closed for the remainder of the year for in-person instruction, and most universities having closed their in-person instruction, to be honest, a lot of what's being done is focused more on the folks that are getting ready to return to their work or their business right now. I'm sure that the Division of Public Instruction and others are working on these. And as much training as we're trying to provide, I believe that these will be available. I just don't have any details right now.
Thank you so much. Next question. Is it enough for employees to post a sign on the door saying, if you enter this area, you are confirming that you have not had any of these symptoms in the last 14 days, and list the symptoms based on what child care is doing to prevent employers from being liable? Do we have to have them sign off on that statement?
I don't think that there are any specific rules or requirements for anyone on that. You just want to make sure that you have engaged in a screening procedure that is reasonable under the circumstances given the nature of your workplace. I think something like that with no sign off would be completely fine for an employer whose employees have limited contact with the public, that they're working in an office environment, something like that. I think that the duty to get greater confirmation, to have temperatures checked by the employer or by the employer ratchets up as the risk ratchets up. And I think it's just a really a risk decision that employers are going to have to make about what makes sense for them and what they think is reasonable under the circumstances to protect their workforce and also to protect any customers or third parties their employees are interacting with.
And I'll just also mention that I'm not really the person to answer these liability questions, but certainly if Division of Public Health or some other entity like OSHA or CDC comes out with a specific recommendation that says, you know, all office staff should be doing this questionnaire, then you would want to follow that. So look for specific recommendations for your type of business as they come out from us at DHHS and others, and you probably want to follow those, you know, to avoid any liability.
Absolutely.
Thank you so much for that. We are at 1 minute before the hour, so I'm going to stop with the questions and want to thank both of you, Veronica and Michael, for your time today. Thank you all for attending today's presentation on COVID-19, reopening best practices for businesses. We hope you found today's content valuable. You will receive a brief survey of the webinar via email. And there is one question that we hope you give some extra thought to. What are your greatest needs or questions as you begin to reopen your business? This information will help the NC Chamber provide the best and most needed tools to the business community. We truly appreciate any feedback you can provide to allow us to improve these sessions. Again, the recording of today's webinar will be made available to you via email within 24 hours of the webinar. Thank you all. Stay safe and healthy during this time. Have a great day.